Brown University launches research on HIV and PH, other health issues. Providence, Rhode Island. A team of faculty and student scholars from the Brown University School of Public Health launched a new initiative to centralize research focused on improving health outcomes among Filipinos and Filipino Americans. The Philippine Health Initiative for Research, Service and Training will bring together the work of researchers from across the School of Public Health along with the university's Warren Alpert Medical School and Global Health Initiative. The initiative offers an opportunity to reinforce and expand a range of collaborative, community-based work around Filipino health already underway at Brown, said Jennifer Nazareno, an assistant professor of behavioral and social sciences. Historically, public health research about the Philippines and Filipinos has been marginalized, she said, or combined with research about other Asian populations despite the fact that Filipinos comprise the second largest Asian American group in the United States. This is the perfect opportunity to highlight and underscore emerging research at Brown about a population that has not been historically centered in conversations about public health, said Nazareno, a faculty director for the initiative. This initiative will enable us to better exchange ideas about what we have learned in our respective research, which will in turn generate more work, more ideas, more collaboration and more visibility. The new Brown Initiative builds on an established partnership with University of the Philippines in Manila funded by a National Institutes of Health grant that has enabled frequent research collaboration between the two institutions, as well as with community partners in the Philippines. Much of the initiative research will center on the intersection of social science, policy and public health. Nazareno's research focuses on the experiences and health outcomes of Filipino women healthcare workers who make up a large part of America's nursing and long-term care workforce. Her work also examines how immigrant Filipino women nurses built health and long-term care businesses as early as the 70s. Don Operario, a professor and associate Dean for Academic Affairs at the School of Public Health, will also serve as a faculty director. Other researchers involved in the initiative include Susan Cu-Uvin, the director of Brown's Global Health Initiative, who with Operario, leads the Brown University and University of the Philippines training program for the prevention of HIV in vulnerable populations, and Arjee Restar, a doctoral candidate in the School of Public Health, who conducts research on how the HIV epidemic is impacting residents in the Philippines. Though the initiative will be led by faculty, its creation was spearheaded by Public Health Master's student Alexander Adia, who worked closely with each of the researchers during a study on HIV stigma and discrimination in the Philippines. They examined health inequities facing Filipinos, particularly as they relate to HIV in the island nation, which faces the fastest growing HIV epidemic in the Asia-Pacific region during the 2018-19 academic year. Alum Adia, Nazareno, Operario and Restar partners with colleagues at the University of the Philippines on research ranging from HIV disclosure in the workplace and legal protections for Filipinos with HIV to the structural barriers that reduce access to contraceptives in the nation. The ultimate goal of these research projects is to help the people we are doing the research for and with, said Adia, who recently received Brown's annual Master's Degree Student Award for Outstanding Academic Accomplishments. These projects would not be possible or relevant without the integration of community voices and goals, without really listening to people and community-based organizations in the Philippines. Thank you for watching. Please subscribe.